Lately, I have been getting a lot of questions about fertility, and because it's obviously connected to pregnancy and childbirth, I thought I would do some videos covering different fertility issues, treatments. I feel like I'm fairly qualified to make these videos because I have worked on and off in the fertility industry for 20 years now. My very first job in high school was at a fertility clinic, and I now own the egg donation agency, Graceful Beginnings Egg Donation. So a huge aspect of what I do is related to fertility. So one of the questions I've been getting a lot is about male infertility. How often is male factor infertility the cause of pregnancy issues? So about 40% of the time, a couple's fertility issues, or heterosexual couples' fertility issues, is a result of issues with the man's fertility. Sometimes it's a combination, sometimes obviously it is just the woman, but 40% of the time it's the man, which a lot of people are surprised by because unfortunately, when a lot of us think of infertility, we think, oh, it must be some issue with the woman. But no, a lot of times it is actually the man. So all male infertility issues relate to either sperm production, characteristics of the sperm, or delivery of the sperm. And these issues, they can result from hormonal issues, or obstructions in the tubes that connect the testicles to the penis. So regarding issues with like the shape, the speed of the sperm. So a couple things that could make it difficult for a man and a woman to conceive would be abnormally shaped sperm that have poor mobility, poor sperm quality, sperm that can't attach the head of the sperm to the egg, sperm that can't penetrate the egg, a low sperm count, or something called azoospermia, which I will cover more in a moment. Okay, so hormonal imbalance can also cause a lot of issues. So an imbalance in the man's reproductive hormones, which are follicle stimulating hormone, which a lot of times is referred to as FSH, testosterone, luteinizing hormone, which we often call LH, prolactin, and thyroid hormones can result in different fertility issues in the man. And then the next thing is obstructive azoospermia. So the general definition for azoospermia is a condition where a man's ejaculation doesn't contain sperm. So with obstructive azoospermia, the absence of viable sperm in a man's ejaculation, it results from an obstruction. So it can occur if there's, blockages in the tubes that carry sperm from the testicles to the penis. And these blockages, they can result from a vasectomy. That's the most obvious. Certain infections or congenital issues or scar tissue from surgery. So things that, again, cause a block and are actually blocking that healthy sperm. And then non-obstructive azoospermia consists of a man producing very, very low qualities of sperm or no sperm at all. And often the levels are so low that they never actually leave the testicles. And this issue, it can occur because of genetic issues or something called varicose, which is veins around the testicles that impede the production of sperm. And the use of testosterone, other steroids, chemotherapy, radiation, those can all potentially cause non-obstructive azoospermia. Okay, so if, a couple is having fertility issues and they go and seek support from a fertility clinic, one of the first things the clinic will do is they will order a semen analysis, a sperm test essentially, after reviewing the man's fertility history or medical history. And so the first thing is you need to schedule the appointment because a specialist needs to analyze the semen pretty soon after the collection. So you do need an appointment for this. To prepare for the semen analysis, men have to refrain from ejaculating. This helps to ensure more accurate results. So for about 2 to 5 days before the appointment, they need to not ejaculate. Typically, they have the man provide the sample in the fertility clinic. There's a special room that you can use to do that. But if men feel really uncomfortable with providing the sample at the clinic, they can do it at home. They receive a special sample collection kit. And then they need to keep the sample at room temperature and bring it to the clinic within an hour of collection. And then next, a specialist thoroughly analyzes the semen's volume, concentration, motility, morphology, which is essentially the size and shape of the sperm. And sometimes the clinic asks the man to later provide a second sample just to confirm accurate results. And in some situations, issues that are detected from the sperm test require the fertility specialist to refer the man to a urologist for more in-depth testing. So genetic testing is something else that's pretty common at the fertility clinic. So if a man has low sperm count or has the absence of sperm in the semen, that's not due to a blockage, so non-obstructive azoospermia, it might indicate abnormalities in the number of chromosomes or in the structure of the male chromosome. So genetic testing can help determine if that is a potential cause of the man's fertility issues. They also do a blood test to evaluate the man's hormones, which I mentioned earlier. And these hormones, they impact a man's sperm production and sexual function. So they're very important to fertility health. And then there's also specialized exams. So bear with me as I pronounce these exams. So one is hypoosmotic swelling test, sperm penetration assay, human zona pellucide binding test, and computer-assisted semen analysis, which we often refer to as CASA, C-A-S-A. And so after reviewing the results from these evaluations, the fertility clinic, if it shows that there are various issues, depending on what the issues are, then the fertility specialist can recommend different treatments. So one of the most common treatments for male fertility issues is IVF, which is in vitro fertilization with ICSI. And this is intracytoplasmic sperm injection. So what this means is that during the IVF cycle, and I'm going to have, or I just posted a video about IVF and everything that entails. So watch that for an in-depth review of what happens during an IVF cycle. But when you're using ICSI with IVF, when the doctor delivers the woman's eggs to the lab, usually the embryologist just mixes just a sample of the man's sperm with each of the eggs, and then they just allow like a good or like the fastest, strongest sperm to get in there and fertilize that egg. But in the case of ICSI, the embryologist looks at the sperm sample and selects just one healthy sperm and injects that one healthy sperm into the center of a mature egg. So we're not taking any chances that potentially like an unhealthy sperm fertilizes the egg. We're choosing one healthy sperm. You can also do IVF with MESA. This is microsurgical epididymal sperm aspiration. I'm not sure if I pronounced that right. We usually just call it IVF with MESA, M-E-S-A. Okay, so this technique involves the collection of semen from men who can produce sperm but can't ejaculate the sperm. So usually that sperm is collected directly from the testicles. An IUI is a less invasive fertility treatment for the woman. Obviously, for a man with all fertility treatments, all they're doing is providing a sperm sample, at least physically. I know emotionally men do a lot more during a fertility cycle, but the woman is the one that has to go through the treatments. So intrauterine insemination, also called an IUI. So this is a pretty simple procedure that involves the woman tracking her ovulation, and then on the day after ovulation likely occurs, the fertility doctor will insert sperm from the man directly into the woman's uterus. And this can be an effective treatment if a man has, or if there's the presence of anti-sperm antibodies in either the man or the woman. The man has a low sperm count, or the man has low sperm motility. So pretty simple one. The man would obviously provide the sperm sample ahead of time for this. And then the last is IVF with donor sperm. So if the fertility doctor determines that there's a really, really low chance of the man's sperm resulting in a healthy pregnancy, then they might need to utilize a sperm donor. Okay, so that's a fairly general overview of male fertility issues, the testing, the treatments. If you have any questions at all, please let me know in the comments below.